Hello, my name is Caitlin Fogel. The purpose of my presentation is to demonstrate the relevance and usefulness of the post-TAVR optimization application. The post-TAVR optimization app is an educational reference tool for the post-op care of a TAVR patient. This app was created by physicians who wanted to both standardize post-procedure care for optimal patient outcomes, as well as provide an interactive illustration of how clinical variables can impact hospital reimbursement. While patient care is the top priority, reimbursement from CMS can impact a TAVR program's sustainability. Many professional nurses will only utilize the post-procedure care portion of the app. This app is available to download for free on both Android and iOS platforms and is smartphone, tablet, and iPad friendly. The main three goals of this app are to improve patient outcomes, shorten length of stay, and reduce financial burdens on hospitals. The app accomplishes this in three ways. The first component is the post-procedure clinical pathway. These pathways provide applicable nursing interventions and information pertinent to the care of the patient from immediate post-op care through discharge. The second component are the TAVR reimbursement resources, which are meant to showcase the importance of proper documentation and the role that plays within reimbursement. The third component of the app is the reimbursement calculator. The app is incredibly easy to navigate. The picture you see here is the default main page when opening the app. The Clinical Pathways button, which can be found at the top of the list, directs you to patient care guidelines. The TAVR reimbursement button offers three hotkeys within it to redirect you to clinical factors used by Medicare when calculating reimbursements. The benefit to this is that the information is located all within just one page of the app. These hotkeys save the user time from scrolling through information that may not pertain to their need. The Start a New Case button is where you can input your facility name and choose from a pre-programmed list of various available diagnoses with their appropriate billing code. The simplified pages and appearance allow for ease of use and an efficient flow of information so as not to overwhelm the user. For bedside nurses, the main goal is to provide safe, quality, efficient patient care. The Clinical Pathways portion of the app is specifically designed to reduce patient length of stay while optimizing their care. The steps are listed according to approach, femoral versus apical or aortic, and then further divided by time frame. These checklists of sorts help ensure no detail is missed and allow us to provide care that is in the best interest of the patient. Of course, decreased length of stay results in fewer complications, leading to lower financial burdens, increased reimbursements, and long-term sustainability of TAVR programs. Here you see screenshots from the Clinical Pathways portion of the app. The image you see on the far left allows the user to select between approaches. Once an approach is selected, you will move on to the screen shown in the middle image, which shows your time frame for post-procedure and nursing interventions and considerations that are applicable within that time frame. The image on your far right shows the options provided from the drop-down key under time frame. These are the only pages within the clinical portion, making this app incredibly easy to use. There is no need to type or worry about misspelling, and there is no opportunity for entry of protected health information. The screen shown here can be found under Start a New Case. The image on the left shows the screen with only two options on top. This demonstrates a simple visual approach to reimbursement, with the option to see alternatives if discharge is adjusted. For demonstration purposes, I have shown on the right the comorbidities I have chosen for this patient. We know how large a role ethics plays within the hospital setting. The post-TAVR optimization app involves no personal patient information. Better yet, none of the information is stored within the app. The app was presented to and applauded by the American College of Cardiology as a tool of excellence to use within the TAVR setting. Let's take a look at the pros and cons of this app. The post-TAVR optimization app is easy to use, HIPAA compliant, and offers standardized, safe patient care guidelines. It also offers insight into reimbursement and how that can be affected by clinical documentation. There are a few limitations, such as not having the ability to alter interventions based on real-time information. Also, these guidelines may vary from hospital policy, which could lead to confusion if there was a discrepancy. Overall, I would definitely recommend this app to any nurse providing post-TAVR procedure care.